talk about the arm, we have to discuss the muscles which are present on our arm. We have to discuss the muscles which are present on the arm. So we divide the arm muscles into two compartments. We have the anterior compartment, which is present anteriorly. So this is the anterior compartment, which is present anteriorly. And we have the posterior compartment, which is present posteriorly. So let's talk first about the anterior compartment. We have three major muscles which are present in the anterior compartment. So we'll go with the most common one, which is the Biceps Brachii. And why do we call this Biceps Brachii? Any answers? So if you're thinking that it has two heads, you are right. We call Biceps Brachii because it has two heads. It has two originations. If you remember, I talked about that this is the scapula, and in scapula we have a glenoid cavity. In glenoid cavity, on the superior aspect of it, we have supraglenoid tubercle, and we had infraglenoid tubercle. So I told you that supraglenoid tubercle is actually a place where there's origination of the long head of the bicep tendon. So this is actually where the long head of bicep tendon is coming from. So if you can see, this is the long head of the bicep tendon, and this is inserting at the supraglenoid tubercle. There's another origination of the bicep muscle, and that is actually coming from the coracoid process of the scapula. So if you can see, this is the posterior surface of the scapula. This is the anterior surface. And if you can see, this is the acromion process, and this is the coracoid process. So this is where the other head of the Biceps brachii is coming from. So this is the second origination. So they both combine together to form the belly of the bicep muscle, and they insert at the radius. They insert at the radius. So at the radius is a fairly simple bone, but if you can see, and on the anterior aspect, there is a prominence, and this prominence is called the radial tuberosity. This is called the radial tuberosity, and this is where the bicep tendon actually attaches. The bicep tendon actually attaches. So before we go forward, there's a really important rule whenever you are studying about any muscle of the body. There's a really important rule, and that is that if any muscle crosses any joint, then it will most likely cause movement of that joint. So if a muscle crosses the shoulder joint, its origin is coming proximally to the shoulder joint, and its attachment is coming distally to the shoulder joint. Since it's crossing the shoulder joint, it will cause movement, either it's flexion or extension of the shoulder joint. And if a muscle crosses two joints, it means that it will cause movement at this joint, and it will cause movement at the elbow joint. So you can see that the bicep is actually originating from the scapula, which is proximal to the humerus itself. So it's crossing the shoulder joint. Also, it's crossing the elbow joint. So whenever the bicep contracts, so what happens? There is flexion of the forearm. There's flexion of the forearm, but the bicep can also cause flexion. So this is extension at the shoulder joint. This is flexion at the shoulder joint. So bicep is also responsible for causing flexion at the shoulder joint, as well as it causes flexion at the elbow joint. I hope it makes sense. Another really important function. So this is the function which probably most of the people know about, that it causes flexion. But what the examiner actually like to ask about is another function of the Biceps brachii, and that it helps in supination. So what is supination? So we just talked about this is flexion at the elbow joint, and this is extension at the elbow joint. There's another form of movement that is called supination and pronation. Supination and pronation. So in supination, we bring the palm of the our hand in a way that's facing the roof. So this is supination. Just imagine you are holding a bowl of soup, right? You are holding a bowl of soup. So you have to supinate your arm to hold the bowl of soup. In the same way, if you move your arm like this is called pronation. So just imagine if you move your arm like this, so your bowl of soup is prone to get spilled. I hope this makes sense. So this is supination and pronation. So Biceps brachii muscle also helps with the supination movement. It also helps with the supination movement. I hope this makes sense. Another thing which is really important before we go forward. So all the anterior muscles of the arm, they are all supplied by a similar nerve, that is the musculocutaneous nerve. So these all muscles in the anterior compartment of our arm, they are all supplied by a nerve called musculocutaneous nerve, and its origination is coming from the segment C5, C6. So how do I learn the roots of different nerves? So there was a nursery rhyme which we used to learn. That was, so it's C5, C6, pick up the sticks. So C5, C6, pick up the sticks. C7, C8, lay them straight. I hope this makes sense. So basically, the tricep is actually innervated by C7, C8. So you are laying your basically C5, C6 flexion, and C7, C8, lay them straight. This is extension. I hope this makes sense. The second muscle which we'll be talking about, that is the Coracobrachialis muscle, and its origin is hidden in its word. It is actually originating also from the coracoid process of the scapula. And can you see where it's inserting? It's actually inserting at the shaft of the humerus, on the medial side or the lateral side. So it's inserting on the medial side. And you can imagine, is it crossing two joints? No, it's only crossing only one joint. That means that when it will contract, so when it will contract, it will flex the shoulder. It will flex the shoulder, not the elbow joint. It functions to flex the arm at the shoulder, and it also causes weak adduction. And you can imagine, if a muscle is originating from here, my palm is the origin and my fingers are the insertion. And if my arm is abducted, so when I will contract it, it can cause adduction of the arm, even though it's weak adduction. It's also innervated, like all the muscles of the anterior compartment. It's innervated by the musculocutaneous nerve. The third muscle is the brachialis. So its origin is coming from the shaft of the humerus, just the middle shaft of the humerus. It has origin from the anterior aspect, the lateral aspect, and the medial aspect. And it's inserting at the level of ulna. And you can imagine, when this muscle will shorten, what action will it do? It will flex the forearm at the elbow joint. So yeah, so the function is flexion at the elbow, and its innervation is by the musculocutaneous nerve, which is again C5, C6. So what is the blood supply to the anterior compartment? So there is a singular blood vessel that supplies all of the muscles of the anterior compartment, and that is the brachial artery. Branches of brachial artery supply the muscles of the anterior compartment. And with that, we are done with the anterior compartment. Just one more thing. So in the next slide, we can see that these are all the three muscles of the anterior compartment. This is the coracoid process. It houses origin of two muscles. One was the Biceps brachii, and the other was the Coracobrachialis. So in green we have the Coracobrachialis, and in red we have the Biceps brachii muscle, and in blue we have the Brachialis muscle. So can you guess what this sign is? You can see there's a prominence in the bulge of the biceps. This is not normal, this is actually pathological, and this happens when there is rupture of the tendon of the long head of bicep. So we just discussed that the Biceps brachii has two tendons. One, the long head, which is actually originating from the superior glenoid tubercle. So basically there's a rupture of that tendon, and just imagine our muscle, when it attaches in our body, just imagine that it is stressed to get fit on the bones. So it's actually in its natural state, it's actually stressed. So whenever there'll be a rupture, it will try to go back to its normal state, that is in a more contracted position. So normally the muscles on our body, they are stretched, and there's an active tension which is present between the two tendons in the bulk. But whenever a tendon ruptures, so it will go back to its normal bulky state, and this is what we are seeing. There must be a rupture in the tendon which is inserting at the supraglenoid tubercle, and because of that we have this sign. This sign is called the Popeye sign. I'm sure you guys must have seen, if you're born in the 90s, you must have seen the cartoon Popeye. He used to have ginormous biceps. That is why we call this the Popeye sign. Okay, and with that we are done with the anterior compartment.